Now, the government's always insisted that it was following the science on coronavirus. But in recent weeks, the economy has also had a big impact on decisions as well. In just a few days' time, pubs and restaurants across the UK will start to reopen. And on Tuesday, the Prime Minister will make a major speech about the economic recovery. So is the science still the guiding principle? Let's try and find out. We're joined by Sir Mark Walport, who was the government's chief scientific advisor for 4 years and who sits on the SAGE Advisory Committee. Thank you very much for being on the show. Well, as I just said, the reopening of the hospitality sector, of non-essential businesses has already begun. Some scientists are split on whether they think it's a good idea. How comfortable are you with the idea that the economy does seem to be slowly being reopened?
Well, I mean, the economy is as critical for health as anything else. And so it's been a fine balancing act all along. And so there are health harms from a damaged economy, from people being out of work. And so one's got to balance the managing the coronavirus pandemic, controlling it, but also keeping the economy going.
At the same time, though, of course, some people are worried that by reopening shops, pubs, restaurants, we could actually be pushing up the rate of transmission, which could lead to another spike, damaging to the economy too. We'll talk more about the reopening of schools in the programme. Is that something else that could push up the rate of transmission?
Well, I mean, again, it's about how you open up the economy whilst managing to maintain as much social distancing as you possibly can. And so it's why staying apart, keeping the numbers of people low in shops, for example, wearing masks if you're going to be in close proximity, all of those things really matter. And so it's this balance between getting things going, but making sure that people take personal responsibility, because at the end of the day, it's down to each of us as individuals to use our sense to try and reduce social contact as much as possible. It's that balance all along.
And is the balance right at the minute?
Well, I mean, the answer is that where the science comes in is that there's very close monitoring going on all of the time. And what the Office for National Statistics data shows that at any one time in England at the moment, there are around 1,100 people actively infected. There are about 3,000 new cases a day across England, with sort of similar proportions across the whole of the UK. And we know that there are about 890 cases confirmed by testing each day. So the virus is out there. It is very widely distributed. And we have to have constant vigilance. And so it also depends on people, if they get the symptoms, if they get high fever, if they get persistent cough, if they lose their taste or smell, then they've got to use their sense and isolate themselves. And their contacts have to isolate as well.
I mean, when you read out those figures, it does feel like we have a relatively high prevalence of the virus still among us. If the isolation is to work, like you say, we also need a really effective track and trace system where people are being tested and then their contacts traced. Are you confident that that is working as it should?
Well, I mean, the numbers speak for themselves. The numbers are building up. So I've got the numbers here. Between the 11th and the 17th of June, there were, multiplying up those 890 cases, about just over 6,000 that were tested. And they managed to reach 70% of those. And about 75% of those, the 4,870, gave details of contacts. But, I mean, the answer is it's not a perfect system. It's not perfect anywhere in the world. And it does depend, as I say, on people being sensible and responsible.
Sensible and responsible, and of course, taking that responsibility seriously. Do you feel that a second spike is inevitable?
Inevitable is a very strong word, and it depends what one means by a second spike, because I think the other thing that's coming clear now is that when outbreaks occur, they typically occur in clusters. And we're seeing certain work environments, for example, food processing factories, as being fairly common places for those clusters to arise. In Korea, they found, for example, in places of worship that clusters have arisen. And if you like, the common denominator is really being indoors, being crowded, being there for prolonged periods of time, and sorts of noisy environments where people are coughing and shouting, and so there's more droplet transmission. And so again, it comes back to local control being really important to identify those clusters when they happen and clamp down on them quickly. So the answer is that we need to do everything we possibly can to avoid a widespread second wave. The evidence that the virus does transmit better in cold workplaces again suggests that winter might be quite a risky time again.
Yeah, I wanted to pick up on that because I was really struck by the number of cases that seem to be being found at these food processing plants, these factories, where there are, of course, refrigerated temperatures. Yeah. Do you think that could be a real warning sign that this could come back in winter at a time when the NHS is already under more pressure?
That is obviously a significant risk. And what's probably happening is that in these cold, probably slightly damp environments as well, the virus, which requires probably a bit of moisture because an enveloped RNA virus to survive, just lasts longer in the air and on surfaces in cold, wet environments. But of course, it is an additional problem in winter because that's the time when there are other viruses. So there's nothing particularly unusual in coronavirus in that respect, but it's the time when flu comes on the scene and all the other coughs and colds and sneezes that we get in wintertime.
Now, you, of course, have been looking at the hunt for a vaccine as well. I remember those headlines saying one might be ready by September, which feels quite optimistic now. What is the current situation on the hunt for a vaccine, and when do you think one could be available?
Well, I mean, the current situation is that there are vaccines around the world, and I mean, the UK is one of the global leaders in this, and two of the vaccines, one from Oxford and one from Imperial College, are now going into clinical trials. And we're also in a position potentially to manufacture these at a large scale. But the answer is that before you vaccinate at the level of the population, you need some evidence that the vaccine works and also that there are no unforeseen harmful side effects as far as possible. And so in terms of large-scale vaccination, that's extremely unlikely until next year. But there may be very significant trials starting from now through to the autumn.
You say there, of course, we're still learning about this new virus, what immunity we'll have, how long that will last for. Is there a chance that we may not actually get a vaccine at all for coronavirus that works effectively? And could this be something that you think that we'll always be living with?
Nothing is guaranteed, but there is natural immunity to this virus in the sense that people's immune system does actually bring it under the control. So the very fact that we get better is because our immune system is responding. And so I think, we would be unlucky if there wasn't a vaccine that worked eventually, but nothing in life is absolutely guaranteed. And of course, I mean, the other thing that the UK is actually doing well in globally is around the research on the clinical treatments that work. And so the recovery trial, a trial which has been jointly funded by the National Institute of Health Research in the Department of Health and Social Care and UK Research and Innovation, has shown, for example, that dexamethasone, which is an anti-inflammatory steroid, has a significant effect in reducing mortality in patients with severe disease. Now, it isn't a magic bullet, and we don't have a perfect antiviral agent yet, but we have to take all the approaches. And so we need not only to put all our effort into vaccine development, but also into developing new drugs, new antiviral agents, new agents that might deal with the sort of the lethal second phase of the infection that unfortunately affects a small but important minority of people.
Now, just finally, of course, we'll be looking back at the response to COVID-19 in many years' time. We won't have a clear picture until then, but it does look as if the UK could be on course to have a higher death toll, a worse economic hit, potentially a longer lockdown than some of our European neighbours. Now, there will, of course, be criticism directed at the government for its response, but I just wonder whether British scientists need to share some of that responsibility too. Just looking at some of these SAGE committee advice in February, SAGE saying that where there is sustained transmission in the UK, contact tracing will no longer be useful and prevention of mass gatherings wouldn't be effective in limiting transmission. On the 10th of March, saying public gatherings posed a relatively low public risk. I mean, do you accept that on COVID-19 it does seem that scientists in the UK have got some things wrong?
I think that, the retrospectoscope is a very, very powerful instrument, as I said before, and I think that there will be plenty of time to look at inquiries. I think that, did the UK lock down a bit later than it should? I think history will probably show that it did. But I think we're talking about, decisions of days. And the scientific advice was always very strongly to test. And I think that one of the other things that will need to be looked at later is the whole sort of logistics of the response and how much as it were, the UK and other countries paid in the insurance policies in advance to protect against pandemics. It was the top thing and still is the top thing on the UK's National Risk Register. And I think that what history will also show is that those countries that had experienced previous very nasty epidemics of infection have been better prepared. And so it was in Korea that they had an outbreak of the MERS coronavirus, which is, if it can be imagined, very much worse than actually the COVID-19 crisis that we're going through at the moment. The countries that had bird flu, the countries that had SARS, the first sort of variant of this, were all better prepared. And I think that that's one of the important lessons, which is that we need to worry a bit more about the next emergency, as well as actually being well prepared for the last one.
Yeah, very quickly, because it's been very interesting hearing what you said. Do you think the government has been listening to the science?
I think the government have been listening to the science throughout. But it comes back to your first question, actually, which is, at the end of the day, the policymakers, and it's not the scientists who make the policy, it is entirely politicians who are the policymakers. They've had to balance a series of very difficult, conflicting issues, which is the major harms that occur to society if supply lines break down, for example, if transport systems break down, and all of the effects on the economy. And, schools is another example where we know that children will come to harm if they miss out on their education for any prolonged period. I'm afraid it's, much easier to be the scientific advisor than it is to be the policymaker.